Hi, my name is AJ and I'm a nurse here at Ward Institute. Today we're going to talk about what it's like to go through surgery and what to expect. So what you can expect the day before surgery, one of our registered nurses will call you or text you with your arrival time, and then they'll give you some generalized information about when to stop eating or drinking, what meds to bring with you for the day of surgery, and make sure that you have a ride home that can get you home from surgery safely. Morning of surgery, you will meet one of our registered nurses in the lobby here, and they'll take you back to our pre-op waiting area where they'll go over consent paperwork, give some pre-medications, and get you all set up and started for surgery. When you get brought back to the pre-op area, a registered nurse will take your vital signs, sign some consent paperwork with you. They'll likely, if you're a female and of a certain age, take you for a pregnancy test, and then they'll have you get changed into one of our gowns and get ready for surgery, at which point they will start an IV for you. And then your surgeon or surgeon's assistant, as well as our CRNA, will come in and speak with you prior to going back to the OR. Once you're brought into our operating room with the assistance of a registered nurse and then a CRNA who will be providing your anesthesia for the surgery, we'll get you connected to all of our monitors in the operating room, and at which time we'll slowly drift you off to sleep and begin your surgery. Once surgery is completed, a registered nurse and a CRNA will then take you to our PACU, or our pre-anesthesia care unit, which you'll have your vital signs checked and kind of slowly wake up in that process. Generally during this time, we contact whoever your ride's going to be or a family member to let you know that you've made it to the recovery area and that they can start heading in. We bring them back to see you in our recovery area, and then we talk specific discharge instructions. Once you're kind of safe, your vital signs are within your normal kind of limits for yourself, you can kind of give me 2 thumbs up, you're feeling okay. We'll go over all discharge and care instructions with your loved one, and then we'll take you in a wheelchair out to your car and get you home safely. A registered nurse will tell you afterwards when you can safely start eating foods again. They'll kind of recommend that you start with easy to digest foods, something like smoothies or soups. So they'll tell you when you can restart your diet if you have any restrictions to your diet whatsoever. And then they'll also go over your kind of first 24 hours of first night of care in extensive detail with you. They'll tell you exactly what home medications can safely be continued and which ones need to be delayed for a few more days. And they'll also go over the schedule of medications that were prescribed for your surgery so that you know when and what to safely take. Depending on the type of surgery you have done here with us, you'll go home with certain dressings on your face, at which time we'll kind of tell you how to care for those dressings and how to care for yourself after surgery. Generally, we say the first night after surgery, once we get you home, you kind of have the night to relax. There shouldn't be too much wound care or dressing care that you need to provide for yourself. Our main goal is to get you home, get you comfortable, and get you through your kind of first night of sleep. Then starting the following morning, we'll tell you exactly how to care for your wounds. We will also go over specific untoward outcomes that we would look for, so like excessive bleeding or any of those side effects or symptoms after surgery that kind of warn us that something, you might not be doing that well, and we'll tell you, when to call the office when you have questions or concerns, and how to get a hold of anyone that's on our on-call services, which we have someone on call 24 hours a day, every day of the year. So if you need to get a hold of someone, you'll always be able to reach someone in our office or medical staff through that on-call phone number.